We've heard for years that dental procedures could be billed through patients' major medical insurances. And there are a few systems out there that have tried their best but have failed. Until now. Integrated Health Services Portico makes dental to medical integration seamless and pain-free. When a patient calls to schedule, simply send them a portal link to prepare their medical health questionnaire before they ever come into the office. When the patient comes to the office for care, Portico will already have verified the patient's benefits, and if approved, will direct you to ask a few qualification questions to help determine whether medical necessity exists. If it is determined that the patient has the proper qualifications for medical billing, Portico will allow for you to choose from the desired procedures. And Portico's revolutionary intelligent medical guidelines will take you through the medical necessity guidelines for that patient's particular policy for those particular procedures, simplified to a handful of yes or no questions. Within 3 minutes of your patient entering the office, Portico will determine whether your patient meets their medical necessity guidelines, and if they do, Portico will guide you in completing the proper workup. Portico's proprietary workup engine will guide you through selecting through diagnostic codes that are pre-selected and authorized according to insurer and policy guidelines. Portico will then help you to select procedural codes that are already determined to be medically necessary according to the particular insurer and policy for your patient. In addition, Portico will inform you of the amount of reimbursement required from the insurer pursuant to your patient's policy. Portico will collect other necessary or required information about your findings and will guide you to upload the required documentation for your patient's procedure. Once you have all of the desired documentation, Portico will generate a letter of medical necessity for prior authorization with the push of a button. Simply click the Submit button and Portico will send the entire file to the insurance company for prior authorization for the procedure. As soon as the insurance company approves the procedure, the prior authorization code will appear in your queue, and you can then perform the procedure for your patient. Afterwards, with the click of a button, Portico will generate an operative note with all of the correct diagnostic codes, procedures codes, insurer guidelines, and required documentation. The average dental office incurs a 74.8% overhead. With just 4 procedures each month billed through major medical insurance, the average office will increase net revenue by 200%. Contact us today and see how you can get started with the next phase of your success. Dental-integration at myihscare.com. You are now ready to bill your procedure. Portico will either download all required billing forms, fully populated to your EMR, to your computer for manual billing, or you can use Integrated Health Services' own billing service to submit claims. Double your office's net revenue with just 4 patients each month, billed to major medical insurers. Contact us today at dental-integration at myihscare.com and find out how you can be on your way to a new practice experience.